everybody. Thanks for joining us right on time. I wanted to say we're going to pull up our first slide, and while everybody's joining us, I want to plug our office hours that we're going to have this Friday at the same time, featuring the same two experts who are joining us this morning. Office hours is an opportunity to ask more specific questions about OpenNotes in a more informal group setting. I believe Deb is going to throw a link in the chat box right now in case you want to register for office hours. It's a more small, intimate setting. And thanks to Amanda, who's running the slides right now. So welcome to OpenNotes 101 for Clinicians with Dr. Sarah Jackson of Harborview Medical Center in Seattle, Washington, and Dr. Cait DesRoches, the Executive Director of OpenNotes. My name is Liz Salmi, and I am the Senior Strategist of Research Dissemination for OpenNotes, and I'll be introducing you to the cast of characters along the way. In case this is your first time joining us, you should know OpenNotes is not a product or software. OpenNotes, is proper noun, is a research team based at Beth Israel Deaconess Medical Center in Boston. As researchers, we've been studying the effects of shared clinical notes on patients, care partners, and clinicians for more than 10 years. OpenNotes works with collaborators around the country and now overseas to foster and evaluate the spread and implementation of shared clinical notes. We call these OpenNotes. We are funded entirely by federal and philanthropic gifts. So we are really excited about today's presentation. Think of the next hour as this crash course on OpenNotes. And in the coming weeks and months, we'll be providing more webinars around different aspects of OpenNotes. But today is the basics, the 101. We're sharing info with you in 3 short segments. So first, Dr. Cait DesRoches is going to cover 10 years of research in a few minutes, plus a tiny bit about a new federal mandate you may be aware of. Then we are going to share 2 short video clips from real patients talking about their OpenNotes experiences. And then finally, the main event, Dr. Sarah Jackson is going to share her experience and tips after 10 years of sharing notes at a safety net hospital with patients. And then we're going to go into Q&A. So that's what today looks like. So let's start with Cait. Dr. Cait DesRoches is the Executive Director of OpenNotes and the Associate Professor of Medicine at Harvard Medical School. She's a distinguished health services researcher with expertise in emerging trends in healthcare delivery. Cait, please take it away.
Thank you, Liz. I was just looking at our poll results, and it looks like roughly 3/4 of the people who are on the call with us today have never gone to an OpenNotes event before. So I'm going to give you the background. For you, all of you that are in that 26% that have, just bear with me because we'll get to the main event with Sarah Jackson as quickly as we can. So I'll just reiterate something that Liz said. So OpenNotes are really just when patients can easily read visit notes. OpenNotes, capital O, capital N, is our group. We are a philanthropically funded group who is focused on improving healthcare through greater transparency. And specifically, we focus on sharing clinical notes. We're funded entirely through philanthropy. You can see on this slide a smattering of our major funders, and we're located at the Beth Israel Deaconess Medical Center in Harvard Med School. We don't have an app. We're not a vendor. We don't have a server full of notes somewhere that we're mining for information. We simply are promoting the idea of promoting and studying the idea of greater transparency in healthcare through sharing clinical notes. I'm going to start out just with a quick reminder about why notes are so valuable to patients. So you can see here on this slide on what a patient typically sees, an after visit summary, which includes things like, yep, I'm still the same, here's my weight, and here's my vital signs, versus on the right, here's the note. And it has lots of information for the patients. It has information about follow-up care, what we discussed during a visit, and it's just a much richer source of information about what happens during a visit than that typical after-visit summary is. So over the next few minutes, I will summarize 10 years of research and give you a quick snapshot on what's next for our group. So OpenNotes began in 2010 in 3 states, and there's a Seattle, Harborview Hospital in Seattle, where Sarah Jackson practices, so she'll be talking later. Geisinger, which serves a primarily rural population in Pennsylvania, and then our institution, the Beth Israel Deaconess Medical Center, which is an academic medical center in Boston. And the idea was very simple. We recruited a set of primary care providers and a set of, and we opened their notes to patients, and we surveyed them before and after the intervention. So you can see here, before the intervention, the physicians were concerned. It does not fully capture how clinicians felt about this idea. They were worried about workflow. They were worried about confusing and offending their patients. They were worried that their offices would be overwhelmed with phone calls and emails about things people were reading in the notes. And on the patient's side, patients thought, yeah, this sounds like it'd be a good idea, but I had no idea that this was even a thing. I didn't know that you wrote notes about me, so sure, we can give this a try. After the survey, the intervention ran for a year, and then we surveyed them in the post-intervention period, and the physicians on the whole thought this was fine. In fact, one of the remarks that we got was, are you sure that this is turned on? Because I'm not hearing from my patients the way that I thought I would. So most of them thought it was fine. It did not lead to an increase in their workload, either phone calls or emails. And all of them chose to keep sharing their notes with patients, even after being offered the option of turning it off. And on the patient side, they really liked it. Most of them read at least one note. Almost all of them said it was a good idea, that it helped them to feel more in control of their care, to do a better job with their medications. They reported sharing their notes with other people who were also involved in their care, like a spouse or an adult child. And we also found that the benefits persisted and in some cases were more likely to be reported by patients who we think of as traditionally underserved by the healthcare system. So patients who self-reported that they were from a racial or ethnic minority group, patients who had limited English proficiency or lower levels of formal education were more likely than other patients to report benefits from reading their notes. We recently, or somewhat recently, 2 years ago, went back and resurveyed at these same 3 sites. So in the intervening years between the pilot and this new survey, all of the sites opened their notes in virtually all of their ambulatory care settings. So we wanted to understand whether these benefits would persist when more patients were reading, and when patients were reading notes across a broad range of ambulatory care settings and specialties. And overall, we found that these benefits persisted. Patients still said notes were very important for taking care of themselves. Almost all of them said they understood all or nearly everything in the note. That reading notes helps them to understand their medications. About 20% found an error in their notes, and when we asked clinicians this same question, they also said about 26% of them said that there was a time when a patient reported a clinically important mistake in their notes. The clinician themselves thought that the mistake was clinically important. And we continue to see that these benefits were more likely to be reported by patients who had less formal education and limited English proficiency. And for clinicians, after 7 years, the majority say that sharing notes is a good idea, that it's helpful for engaging their patients. Most of them would recommend it to a colleague. Very few reported questions or concerns from their patients. Now, about a third say they spend at least somewhat more time in their documentation. We don't have a measure of what that somewhat looks like, but there is a brand new study out just recently that showed that the increase in time, that they measured it by measuring how long from when the note was opened in the EHR to when it was signed off on. And the increase post implementation of OpenNotes was just a few seconds. So it's a small amount of time. However, if clinicians are thinking about how they might write their note a little differently, if patients are reading it, then I think it could probably feel like more time, which is important. So since that early pilot, OpenNotes has continued to spread. We, on the strength of those findings and some very generous foundation funding, we've been able to really work at perfecting our own dissemination practices. So how do we spread best practices around note sharing to other healthcare organizations? And so we know of about 260 organizations that now share notes with patients. And among those organizations, 53 million people are signed up on their portals. So 53 million people across North America now have access to their notes. And this includes large and small organizations, rural and urban, and the entire VA. And an additional significant change since the pilot is a new public policy. So some of you may actually be on this webinar because you know about the new public policy. It stems, so it has its roots in HIPAA, which, while it's a very complicated piece of legislation, the simplest part of it to understand is it gave patients the right to access their medical records, so it starts there. Augmented by the HITECH Act, which incentivized organizations and clinicians to adopt electronic health records, and those electronic health records had to have a patient portal. And then finally, the 21st Century Cures Act, which was primarily about biomedical innovation, but did have a section in it focused on improving interoperability, or how data flows between clinicians and between organizations and patients. And in that legislation, there's a line that says that patients have to have electronic access to all of the information in their electronic medical record. So fast forward 4 years, and we get to the interoperability and information blocking rule. So that is essentially, this rule is the implementation of that portion of the 21st Century Cures Act. And it requires a greatly expanded set of information to be electronically shared with patients. And this includes progress notes, 8 different kinds of notes, including progress notes. It was set to be implemented in the fall, but was pushed back because of the COVID pandemic to April 5th of 2021. Lots of progress from an early pilot with 100 primary care clinicians in 2010 to 2021, where we will see that all organizations will have to share notes with patients. And so as we think about our kind of success that we've had with dissemination, we continue to think about, well, how can we do this? How can we implement this in a way that means that we actually get to the benefits and patients are really reading their notes? So we're still focused on best practices around implementation. We have projects focused on sharing notes with care partners, with how this affects how we can engage with vulnerable populations. What about mental health notes? That's a big issue with this new transparency. We have work on the bioethics of sharing, how sharing can improve patient engagement, patient safety. And finally, we have pilots focused on a kind of bi-directional sharing of notes with patients, where patients are actively asked to author a portion of the note before the visit. So lots of work left to be done. And I'm going to stop there, say thank you, and pass the mic back to Liz.